Well, we were looking especially the reforms that World Health were talking about, and increase in cost, especially with the recession that we're experiencing throughout the world. We know that World Health will likewise be affected. And small island states like the Bahamas, if the costs went up dramatically, it can have serious impact. We were also concerned that if World Health received less funding, then some of the programs that they offer to small island states like ourselves may be cut, and therefore can really have great impact on us. We had met with the CARICOM delegation, and we agreed to a particular cost, one of the items, item D, for example, and it would not necessarily have an impact on our expenditure, because what you'll find is that some of the territories may have minimal increase and some may have decrease, and we feel that that's quite well. World Health, what was most impressive is that with the reform, they're focusing more on results oriented. So you utilize, yes, you have less funds, but you would concentrate on transparency, and you'd concentrate on making that funds count wherever it's utilized, minimizing wastage. And we think when you're talking about a recession that's being experienced today, one has to really ensure that accountability and transparency and the monies are truly spent on the necessary programs. So we're quite happy with the outcome there. With health, the public sector has plays a very, very important role. And in terms of the environment, we know that if you don't have adequate water, garbage collection, etc., if you have problems in terms of vector that can have effect, all those would affect the health. In our situation, if you don't, well, we have good potable running water, but there are some countries where they may have problems with potable running water, and that can have impact on both the environment and the health sector. For example, malaria. You can have malaria problems, and therefore, because we are within those areas that may have problems with malaria, we would likewise be exposed to it. And therefore, we came here, met with the CARICOM group, and one of the issues that we brought up with PAHO was that, can you assist in vector control or vector eradication within not only the Bahamas but within the CARICOM community? Because if you control it in one sector, not in the next, then it's a spillover effect, and therefore it still be affected. So I think that's very, very important for us, so that we can look at malaria, prevent malaria from spilling over in our environment. And we know that once we, from the environmental perspective, once we control the mosquito breeding sites and have proper water, we would be on the right track. Alcohol can affect the newborn as well as affect the adults. And one of the items we're talking about, agenda item, we're talking about violence, and alcohol obviously will have an impact on violence, and that would have a great impact on our primary healthcare sector as well as the tertiary sector. So if you control, or if you have minimal problems with alcohol, then obviously that would have a great impact on your healthcare system. You'd have less problems in terms of congenital problems that you may see related to alcohol consumption, chronic alcohol consumption. You'd have less patients present to the primary healthcare sector, be it with some liver problem or some other problems, because they're usually seen initially in the primary sector and subsequently referred to the tertiary sector. So I think alcohol and smoking, if we were to reduce or control that, I think the expenditures that we see within the healthcare sector as a result of illnesses related to them would definitely decrease, and therefore you'll have more monies to be utilized for programs like we mentioned earlier, and programs will be not only national but regional programs, and you have less monies that would you would have to spend in one particular sector, so that the problems that we're experiencing today in terms of recession, if you've conquered the problem in one particular region, then you have more money to spread out for other regions so that everybody can benefit. It's a lot of educational program in terms of throughout the healthcare sector, where we introduce a law, though it's not enacted yet, in terms of alcohol and driving, where we can monitor the blood level and enforce the laws. Unfortunately, it's not enacted yet, but we're moving towards that, so that we can control alcohol with respect to drivers, and therefore that will subsequently reduce the amount of motor vehicle accidents related to alcohol, and subsequently have less impact on both the primary and tertiary institutions. Yes, I think you need to develop programs, because alcohol is having a great impact on road safety. We do have motor vehicle accidents related to alcohol. Not only that, we have seatbelt regulations, and you find that individuals who consume alcohol or have alcohol within the car itself, because they're somewhat unstable, they don't enforce the seat regulations, and the kids, the young ones, are at risk of being injured, and you have to enforce those rules, those laws. I think it's a worldwide concern. Because Bahamas is a small community or a small country, we would not see the amount that you see internationally. But from a statistical perspective, we would see it also. One has to educate the public in terms of overuse of antibiotic, where you get resistance and possibly, and at the same time the medical community must also understand that certain medications are used in certain illnesses and should be withheld for other illnesses, because then you develop resistance, and when you need that medication for the particular disease entity, it can't be utilized. So we need proper regulations, so that you'd have less medications, individual sharing of medication, and therefore you must have medication that can be given in adequate quantities to individuals. Because if you don't have a constant supply of medication, then what happens is there's a tendency, especially within the poorer group, for them to share medication, and that is what helps to build drug resistance and poses problems. So I think countries would need proper drug supply or programs so as to reduce this problem from developing. Once you have more blood donors, as opposed to individuals being rewarded for donating blood, you find that once those who, if you have a greater pool of donors, you find that you have less problems, all right? Individuals who may know they have illnesses, etc., if their blood is being purchased, then of course they would be more inclined for the reward. I think the blood banks need to be centralized so that they can all be monitored, evaluated, and tested from a more centralized pool, after which it can be sent out to the various different institutions. But I think you need to push more voluntary blood donation as opposed to more donation related to reward orientation because of the problems that you encounter. Primary care is probably should be pushed even more. I think the problems, we just came from a high-level meeting where they were talking about chronic diseases. Primary care, if we were to introduce and have good, effective primary care with good educational programs, but the educational program must not only be within the healthcare sector, must also be within the educational sector also. So we should be pushing more prevention. So I think we must concentrate a lot on prevention, promotion, and primary care, because if we can use that as our gatekeepers and cut back on the tertiary or more chronic or devastating or catastrophic illness, then we cut the costs going into our tertiary institutions. So I think PAHO has been assisting us greatly in terms of primary care. They've been, I'd like to see more health financial reforms, and we get assistance from PAHO in that, because it's been shown repeatedly that you cannot, once individuals are charged at the initial entrance of the institution, the poor groups of people especially would stay away. And therefore, that's the group especially that has the chronic illnesses and has high mortality and morbidity. And therefore, you must have reform, health financial reform, and we'd ask PAHO's assistance in that, so that you'll have some type of national policy rather than individuals having to pay at the entrance and subsequently be detracted from attending or visiting your institutions.